everyone, welcome back to a new video. As promised, I asked you guys in the Facebook group if you wanted me to walk you through sort of a training when you dispense emergency contraception, also known as the morning after pill. So this video is dedicated to walking you through the form that you need to go through with the patient, with the customer, when she presents to your pharmacy to request to receive emergency contraception, or as I said, most of them will say morning after pill. So I will now share my screen with you to walk you through the form. Not all forms will be the same. Let me see now. Perfect. So not all forms will be the same. This one is more complex. It gives you a lot more information. Some forms, depending on the pharmacy, will be more simple. Won't give you as much information. You will need to know it. So in the first section of the form, you obviously have the name and the address. DOB stands for date of birth. So you have to request the name, the address, and the date of birth of the person requesting the morning after pill. You can ask for the GMS number if applicable. So if she fits in the criteria and has a GMS card with a GMS number on it, you ask for that GMS number and you write it here. If she does have a GMS number, then she will only pay €1.50 for the morning after pill. Some pharmacies can actually give it away for free if they're on GMS. So yeah. Then you need to ask if it has been, how long has it been since the unprotected sexual intercourse. So if it's within 24 hours, you tick this one. If it's from 24 to 48 hours, tick this one, and so forth. Is the woman on contraceptive medication? You tick yes or no depending on her answer. And if she's taken any other medication, you tick yes or no, and you actually write it down here so you can check for interactions. All right, that's the first section of it all. Then additional information you can tell by the date of birth when you ask it here. You can actually calculate it yourself and see if she's over 17 or not. If she is, you can go ahead. If she's not, you have to use your professional judgment and most likely refer her to the GP, to the general practitioner. But yeah. Is the medication for woman's own use? So you have to ask the woman that. You have to ask, is this medication for your own use? You have to confirm that she's not actually trying to get it for someone else. Now this is a misspell right here. It should be UPSI, from unprotected sexual intercourse. So it's for short, it would be oopsie. I remember laughing about this when I did my first form, because I wasn't given any training on it. I was just rushed into it, and I remember reading, "What's oopsie?" And then I was like, "Oh, unprotected sexual intercourse." So oopsie is actually a funny shortcut for it. So was the unprotected sexual intercourse within the last 120 hours? You tick yes or no, because that's how long the morning after pill is actually um, is useful when taking it within the 120 hours. You have to make sure that it's been in the last 5 days that the unprotected sexual intercourse has taken place. Okay, was your last period normal? You have to ask this question because if it was lighter, it could mean that she is pregnant. So you have to take that into account. You have to ask for the current day of the cycle, and you write it here. Now you have to ask if this was the first episode of unprotected sexual intercourse in the current cycle. If it's not the first one, if she already had unprotected sexual intercourse in this menstrual cycle, it could mean that she's already pregnant. So the guidelines state that emergency hormonal contraception can be used more than once in a cycle, subject to restrictions. So if woman has taken levonorgestrel, she should not take ulipristal acetate in the following 7 days. Similarly, if she has taken ulipristal acetate, then levonorgestrel should not be taken in the following 5 days. So, the woman that presents herself for repeated supplies of emergency hormonal contraception should be referred for long-term contraception. So, either to GP or any other referral that you see fit, but you can't give out to the same woman repeated emergency hormonal contraception if it happens too often. If no has been ticked in any of above, emergency hormonal contraception may not be suitable. So if she's younger than 17, if she's trying to buy it for someone else, if the unprotected sexual intercourse was more than 5 days ago, if her period was lighter than usual, if she had unprotected sexual intercourse prior to this one in this menstrual cycle, then you can choose to refer to the GP or wherever you want to refer her, and you can actually choose to not dispense the emergency hormonal contraception. So clinical judgment must be used and prompt referral made if appropriate. So you have to tell her where to go. If it's within hours, she has to go to the GP. If it's outside of hours, there are clinics with doctors that are available outside of normal hours, so she can attend that. Yeah, you have to know what clinic is available around your store, like in your neighborhood where you are there. So interactions. Is the patient on an enzyme-inducing drug that could reduce efficacy of the emergency hormonal contraception? Then you have to tick yes or no, and it gives you here loads of examples of medication that has an enzyme-inducing effect, which can obviously impact the efficacy of the medication of the hormonal emergency contraception. And the most common of it is St. John's wort, which you can actually buy over the counter. It's a herbal supplement, but it does have enzyme-inducing effect. So you have to ask for medication if she's taking any medication, even if it's over the counter. It might, like I said, reduce the efficacy of the hormonal contraception. If the patient has been on liver-inducing enzymes in the past 4 weeks, you should refer her to have a copper intrauterine device installed. So if it's within 5 days of the oopsie, then you can refer her to a doctor that could insert a coil, as it's referred to in common language. If this is not an option, you can use a double dose of levonorgestrel. Levonorgestrel. So yeah, you have to use your professional judgment. Either double dose of this or the coil. Refer to the coil. You obviously have to go through with the patient of the possible risks and side effects for each option. Precautions. Does patient suffer from history of, and now, severe liver disease? You tick yes or no. Allergies to any of the emergency hormonal contraceptions that are being used, the levonorgestrel and the ulipristal. And also check for allergies to galactose and lactose. Rare hereditary problems of galactose intolerance, LAPP lactase deficiency, or glucose galactose malabsorption. So yeah, you have to ask this if there's any lactase, glucose, galactose malabsorption. If the patient responds with a yes for any of these, again, the emergency hormonal contraception may not be useful, may not be suitable, and you may refer the patient to the GP or to a clinic to be assessed by a doctor. Ulipristal. So the brand name is Ella One. So Ella One suitability. The Ella One should be considered first line unless it's contraindicated. So first choice when you're going through the form and asking all the questions, if you're satisfied, the first choice for you to dispense to the patient would be the Ella One. Now, you have to ask, is the patient taking oral glucocorticoids for severe asthma? So if she suffers from severe asthma, so much so that she has to control it with steroids, if you tick yes there, then Ella One might not be suitable for her. And if she's breastfeeding, again, if she answers yes, for Ella One, if you give her Ella One, breastfeeding has to be stopped for 7 days, for 1 week. Whereas if you give her the second choice, the levonorgestrel, she only has to stop breastfeeding for 8 hours. Then you have to ask, has the patient been taking a progesterone-only pill in the last 7 days? So if she has taken a progesterone-only pill in the last 7 days, then Ella One would not be as so the efficacy of Ella One would be reduced, and the progesterone pill efficacy would also be reduced. So because the Ella One binds with high affinity to progesterone receptor, so it would make it would make the if she has been taking a progesterone only pill in the last 7 days, it would make the emergency hormonal contraception, the Ella One, less effective, and it would actually make the progesterone tablet that she's taking less effective. So if yes has been ticked for any of the above, then Ella One or ulipristal may not be suitable. So you have to use clinical judgment. If Ella-1 is suitable, continue to advise section. So this is where you decide if you need to use Ella-1, which is the first line, and if you see if she says she's taking steroids for her asthma, if she's breastfeeding and she might want to keep breastfeeding, not stop it for 7 days, which is a lot. If she's been taking a progesterone pill in the last 7 days, then you might consider that Ella-1 is not suitable, and you have to go through to the second option, which would be the levonorgestrel, which comes in many brands. Prevanel is one of them. So this is where you say, is Ella-1 suitable for this patient? And you can tick no. And then you have to ask the questions to see if the second option, if Prevanel, is suitable for this patient. And you have to ask if she's taking cyclosporin, because Prevanel may inhibit metabolism of cyclosporin, thus leading to increased risk of toxicity. So that would have severe side effects. And does the woman have a history of relevant medical conditions, amongst which Crohn's disease, thrombosis, severe hypertension, previous ectopic pregnancy, fallopian tube injection? So you have to go through all of these and ask if she's suffering from any of these. And then you tick yes or no. Is it greater than 72 hours since the first episode of unprotected sexual intercourse? Oopsie. If it's more than 72 hours, then Prevanel would not be the right choice, as it's only meant to be taken in the first 72 hours after the unprotected sexual intercourse. So if yes has been ticked of any of to any of above, then Prevanel may not be suitable. So you have to use clinical judgment. Always keep in mind you can refer for the coil, for the intrauterine device in the first 5 days. You can refer to the GP, and the GP can take a decision. So you don't have to, if you don't feel confident that you're giving out the right dose, the right medication, you can choose to refer. You don't have to actually dispense anything unless you're certain that the patient will benefit from it, and the benefit risk factor is in the patient's favor. Now you have to ask if the patient is over 70 kilograms or 11 stone, if you're going by the British measurement, or if the body mass index is greater than 26 kilograms per square meter. Now, any pharmacist should know how to calculate the body mass index. It's a simple formula, and if the result is above 26 kilograms, so if it's within 20 to 25, it's a normal body mass index. If it's 25 to 30, it's kind of a it means you're chubby, basically, and over 30, you're considered obese. So in case the body mass index is over this amount, the guidelines say that the efficacy of the emergency hormonal contraception may be reduced in this case. So give Ella-1 unless contraindicated. So you go back and or refer to intrauterine device, to the coil, or you have to consider a double dose of the levonorgestrel, the brand name Prevanel, Um, it could be the patient could be given a double dose of it, but since this is outside of product license, you have to refer to the doctor because the doctor has the authority to um, prescribe her a double dose of Prevanel. Or the doctor could decide to go for the coil, um, or you could dispense the LA1, but you have to be satisfied that it's not contraindicated. Um, is the patient breastfeeding? Yes or no? If yes, advise to take the Prevanel immediately after feeding the baby, and skip nursing for 8 hours post administration. So she has to breastfeed the baby, and then immediately after that she has to take the Prevanel, and then she has to skip breastfeeding the baby for 8 hours. After 8 hours, she can start breastfeeding the baby again. Okay, advice. Tick box to confirm advice is given. So you have to go through it all. How many? You have to do all these, and then make sure that you have said all of these. You have to go through this form. You have to make sure you told the patient how the medication works, and then you tick it here. You have to make sure you told her the directions for use, and then you tick here to make sure you did. You have to go through effectiveness and failure rate. So you have to notify her that the more the time um, elapses from the moment of unprotected sexual intercourse, the higher the failure rate goes. So the sooner she takes it, the better. You have to notify her of the possible side effects. Um, you have to give her the advice if she vomits within 3 hours of taking. So basically, it takes 3 hours for the medication to be absorbed in the body. So if she vomits within 3 hours of taking it, she has to come back and get another one because it wasn't properly absorbed in the body. But if she vomits after 3 hours of taking it, she doesn't have to come back because the necessary amount of medication would have been absorbed in the body. So you have to tell the patient that when you're counseling, you have to let her know that she has to come back. If it might only upset her stomach, but it might upset her stomach so much that it might even cause her to vomit. So you have to advise on the 3 hour um, time that the tablet needs to be absorbed. So you have to advise if the next period is late or missing. The patient has to contact the GP, have a pregnancy test, make sure that she's not pregnant. So you have to advise her that there is a possibility that she might get pregnant. Advice on continuing long-term contraceptive, if relevant. So if she says she's not on any contraception, she doesn't use long-term contraception, you might want to advise her on the importance of continuing long-term contraceptive, as the emergency hormonal contraception is not meant to be used over and over again. Advice not to restart any progesterone containing contraceptive for 5 days after ulipristal acetate. So if you give her LA1, you have to tell her that she has to stop taking her pill, her progesterone containing contraceptive, for 5 days. She's only going to restart it after 5 days pause. Advice on alternatives. Like I said, the copper intrauterine device, you can give her advice that there is an alternative, so she could have that installed. advised to read the patient information leaflet. So you have to say, I advise you to read the patient information leaflet. That's what PIL stands for. So I advise you to read the patient information leaflet before taking the medication, so you can familiarize yourself with the possible side effects and with everything that the manufacturer intended the patient to know. Also, you need to advise her to use the barrier contraception method until the next period, and advice on available methods of contraceptives if appropriate. Okay. And in the next section, you will record the product supplied. So if you gave out Elawan or any other brand, you write it here. Batch number and expiry date, you write it here. If no supply made, record reason. So this is where you write under 17 or severe asthma or any other reason that you had to not supply any emergency hormonal contraception at all. You write it here. And then you sign it as a pharmacist and you write in your PSI number. And that's the way you confirm that the information you given is the correct to the best of your knowledge. And then the customer signs down there and acknowledges that she has been provided with the information about emergency hormonal contraception, and that the pharmacy will keep this record for 2 years in line with data protection requirements. So that's the form there for you. That's everything you need to know. As always, if you have questions, you know where to find me, and I will try to clarify it for you. Give me feedback. Let me know how I did on this training. You can give me a grade from 1 to 10 in the Facebook group. Just underneath this, where I will be posting this video in the Facebook group. And until the next video, have a good one. So God bless you.